Good evening, Chair Nose, Vice Chairs Goodwin and Nelson, and members of the committee. My name is Stephanie Winn. I'm a licensed marriage and family therapist with 10 years of experience counseling a diverse array of individuals and families. I share in your goal of protecting gay, gender atypical, and otherwise vulnerable young people from abuses at the hands of professionals who are supposed to help them. But the current, as well as the proposed legislation, does not achieve its intended purpose. In fact, it does the opposite, creating medical malpractice victims and depriving families in crisis of proper care. Detransitioners are a uniquely traumatized and rapidly growing population with complex needs. One of their most common grievances is that when they initially sought counseling for their gender-related distress, no one questioned them. Mental health professionals simply affirmed their gender identity and ushered them along a path of social and medical transition, without exploring their reasons for wanting to transition or properly assessing their psychiatric comorbidities, trauma history, family dynamics, or internalized homophobia, and how all of these might play a role. As a result of this negligence, detransitioners now suffer mental and physical anguish daily, including pelvic pain, surgical scar pain, vaginal atrophy, infertility, inability to orgasm, inability to breastfeed, urinary tract infections, metabolic and endocrine disruption, permanently altered voices, baldness, unwanted facial and body hair, osteoporosis, cardiovascular disorders, and early dementia. All of these ailments place them at increased risk of depression and suicide. These vulnerable patients were victims of therapists who neglected their duty to ask questions, evaluate comorbidities, encourage self-acceptance, and support healthy long-term decision-making. Now they need help for complex psychological and physical trauma, but have very little trust in doctors and therapists. The existing law, ORS 675.850, already makes it difficult for parents to find appropriate help for their children. Parents contact me in anguish, stating it's been impossible to find a therapist willing to explore the underlying reasons for their child's sudden transgender identification. Adolescent therapists are afraid to ask questions for fear of being seen as, quote, trying to change a patient's gender identity, which under the current legislation could be deemed so-called conversion therapy and therefore pose a threat to their license. Even though gender exploratory therapy, asking questions and getting to the root causes, has nothing to do with the abusive tactics of the 20th century that have long been banished from the counseling profession. The things on the Wikipedia page if you look at conversion therapy. The evidence-based approach of watchful waiting, which gives teens time to discover themselves without making life-altering decisions, results in desistance rates approximating 90%, as the process of going through puberty, coming to terms with one's sexuality, and finding one's place in society naturally resolves gender dysphoria in the vast majority of cases without any need for medical intervention. The proposed amendment would make this situation worse by depriving vulnerable adults as well as minors of comprehensive treatment for the underlying issues, such as, for example, sexual trauma, which can drive the desire to be rid of sexual body parts that are associated with that trauma for some people. This bill declares a state of emergency, but there is no emergency of so-called conversion therapy happening right now in the state of Oregon. And you'll be hard-pressed to find...
You're doing all right.
Oregon's true emergency is the lack of proper exploratory therapy, which is not the same as the conversion therapy abuses of the 20th century. Proper exploratory therapy for distressed, vulnerable young people. This legislation will make that worse. Please vote no on House Bill 2458.